She's a doctor.
Hi, I'm Dr. Dovec, and she's a dietitian.
Hey, I'm Hannah Schuyler, and together we are
The Doctor Dietitian Collab.
All right. The biggest question we get all the time is what weight loss option is best? There are so many things out there right now. Obviously, there's bariatric surgery, there's these medications, there's lifestyle management, diet, exercise, meeting with a dietitian for medical nutrition therapy. So many options. And we just wanted to quickly summarize these options so that you can make the most informed decision for you.
Yeah, because I really think that the question isn't or shouldn't be which option is best, but it should be which option is best for me. Because what's best for me is going to be different than what's best for somebody else. And you might be like, I've tried all of these things, or oh, I haven't tried that yet. So maybe that's what's best for me next, or whatever it might be. So I think that's really the key is like, which one is best for me?
Absolutely. And I think that is so important, even within medical weight loss. Gosh, even in surgery, there's different types of surgery, there's different medications, there's different considerations, even coming down to the financial aspect of it.
Yeah.
So let's just dive right on in and let's start with surgery. And let's describe the different surgeries that are out there, or even actually, let's back it up even further and talk about how you even get started with the program. So do you want to talk about how we do it here at Body by Bariatrics?
Yeah, so we try to make it very simple. And, there's a lot of considerations when you're talking about surgery. And typically the first thing that people want to know is, will my insurance cover this, or how much is this going to cost? And so the first thing we recommend doing, if you have healthcare insurance, no matter what it is go on our website, which is bodybybariatrics.com, and you're going to click request a free insurance check. It's right on the top of our website, or you can click get started now. There's a bunch of different buttons on the website, but what that's going to do is have you fill out a form that goes to our team. It's going to submit your insurance information, and they are going to do something called a benefit verification. And what that is, it's not an authorization. It is not saying that you are approved for bariatric surgery or anything like that. All it's doing is checking your benefits to see if bariatric surgery is a covered benefit and an estimate of how much that would cost to you based on your insurance plan. So depends on your deductible, your out-of-pocket maximum, co-pays, all of that. So that's the best way to get started with us is, let's just check the insurance and see. Worst case scenario, it comes back and it says you don't have coverage and it's an exclusion in your plan. Well, great. Then we'll send you the information about self-pay. Now, if you don't have insurance, you can do the same process. You'll click the same links and you'll just do that without insurance, and we'll send you that self-pay information.
Yeah, and thanks to you on our website, we have a billing FAQ section as well. So if you're worried, like you said, we try to make it very easy for you just by inputting your insurance information, no obligations, it's free. We have people who will check things over just to understand if you have coverage and if so, what you have to pay. But we also can then talk to you a little bit about those who maybe you don't have insurance, you don't have benefits for this, or you would just prefer to honestly go right to self-pay because you don't have to deal with the insurance and their policies, and sometimes they're long waits. So self-pay, how does that work if you want to go that route?
So self-pay, pretty easy. We're going to get you scheduled with a surgeon. You're going to pay a fee for your program, like kind of the program side of things. So that covers surgeon visits, dietitian, nutrition education, our Nutri Health program, and then 3 months of follow-up care as well after surgery. So you'll get started with that. You will get onto a surgeon's schedule within a week. It's super fast. We get you on. It's super easy. Those are virtual appointments. Then you would be given your very, very short checklist, which is usually for a lot of people just some online education called Nutri Health. You'll complete that. You'll do a final with the surgeon, same process, virtual appointment, and then we'd get you scheduled for surgery. So that is, like you said, the fastest way to do it. If you are just like an eager beaver and you're like, the time is now, I am ready at this exact moment, you can get in because you don't have to deal with the insurance requirements.
Yes.
We're going to look at you from a health perspective and a safety perspective and make sure that you are a candidate in that sense for bariatric surgery. So sometimes people who are self-pay will have a couple of other things to do. We might want to make sure, if you have a cardiac history, that we're checking some extra things there, anything along those lines. Of course, we're not going to just
No.
willy-nilly let absolutely anybody get surgery, but we're going to make sure that everything is safe and we'll get you going as quickly as possible with that.
Awesome. Yeah, I think that's how you kind of get going in terms of, will my insurance cover? If so, what does it cost? If they don't cover or I don't have insurance, they're self-pay as well. So the financial aspect, we really try to improve access to care. In other words, we try to hope that anybody, all comers, regardless of your economic status, can find some kind of affordable solution. And we really work with you on all of that. Now, let's talk about the surgeries and the different types. So we do laparoscopic techniques, minimally invasive, and we do have some podcasts out there that are actually on YouTube on Dr. X Dietitian. If you type it in, find our YouTube channel, you can actually watch us doing the surgeries, watch me doing them, us talking over them and explaining all of the different things that I'm doing during the procedure and why we're doing them. And we talk a lot about, we have a gastric bypass, we have a sleeve, we have a revisional procedure. So we show these different kind of offerings or different behind the scenes to hopefully make you make the most informed decision and take some of the unknown out of it.
Yeah, absolutely. And those are great. I always tell people when they ask, I'm like, they're not that gross. I think a lot of people think it's going to be like really bloody, and it's really not. So check those out. Feel free if we'll put the links in the show notes too as well for those videos so you can easily get to those. One thing else though that people need to consider with surgery is who qualifies for
Oh,
surgery.
yes.
Like, what does that parameter look like for insurance and then also for self-pay?
So for insurance, they often have policies that you have to abide by in terms of, like you said earlier, there might be some checklist items. So yes, there's always safety, but there's also things like the insurance company may require a psych evaluation. And we have different providers that we send patients to, or maybe you already know a therapist or have a therapist, and we have templates for that. Maybe your insurance might require, like you said, additional clearances. They might need a primary care note or letter of support, letter of medical necessity. They might need a cardiac clearance. They might need additional imaging studies or lab work. If you've had a previous blood clot, they might need that clearance, hematology. So there's lots of different things in that regard. But then there's also who exactly qualifies up front. And it's usually based on BMI, which is body mass index. So usually it's based if your BMI is 35 and above and you have weight related issues like high blood pressure, high cholesterol, sleep apnea, osteoarthritis, pulmonary cardiac issues, then you would qualify. Or if your BMI is over 40, you would definitely be a candidate. However, some insurances are getting more progressive and they are actually following the new guidelines that are put out there by the American Society of Bariatric and Metabolic Surgery and the International Society for Obesity and its related diseases. These two societies came together. They formed a consensus statement saying that BMI is greater than 30 and above because the metabolic improvements should be candidates for bariatric surgery. And some insurances are actually, I'm seeing finally a few saying 30 and up would qualify for surgery.
Yeah. Now, if you're a self-pay patient,
Mm.
we can be more flexible on those because again, we're not dealing with the insurance. So maybe you fall in that 30 to 35 range and maybe you do have insurance coverage, but they're not going to cover because you're not in there. So that's where the other kind of flexibility we can have with those self-pay patients from a standpoint of who qualifies.
Definitely. I think that's the most beautiful thing about the self-pay is that it is a conversation between the two of us, and we determine that, all right, you have this is just a scenario. You have diabetes, it's uncontrolled. You've been on all of the medications. Now you're on insulin. Insulin's making it like a horrible vicious cycle. It's that you're on more insulin, you're gaining more weight. The more weight you gain, the more insulin you need. You need to break out of it. And I don't care what your BMI is, honestly, because I know that surgery, there's multitudes, there's volumes of evidence that show and prove that bariatric surgery, particularly the gastric bypass, is the best metabolic operation that exists. And it will improve or even resolve your diabetes the minute you wake up. So,
Mhm.
I mean, that's a scenario where I don't care if your BMI is 25. I think it's honestly that good of a procedure to get rid of the diabetes.
Yeah. Type 2 diabetes. Unfortunately, we can't cure type 1 with it. That'd be
Great,
amazing
great
though.
point. That would be amazing. Now, there
Yeah.
are some patients who do have a component that their insulin requirements, even with type 1, like you said, you're going to
Hmm.
always need insulin, but that the insulin requirements do go down,
Hmm.
even with type 1 with the
Yeah.
gastric bypass.
Yeah.
So
It's pretty crazy.
it is crazy. So
Yeah.
the gastric bypass, these procedures, they're amazing. They don't even
Hmm.
know exactly why they work or how they work, but they're almost like a supercharged medication that's out there that's getting all this buzz and acclaim kind of in the press and with celebrities and pretty much a lot of
Yeah.
other people now at this point. It's not just for the
Yeah.
super
The rich and
wealthy.
the
So,
famous. Yeah.
no, it's for everybody. So
Well, what a great segue into the
what
next
a great,
option that
yes, let's
people, it's
talk
almost
about
like you planned that.
medications. It is. I mean, my goodness. So these medications are amazing. And
Hmm.
I think a lot of surgeons haven't fully embraced the fact that these are amazing, like adjuvant or additional therapy options.
Hmm.
I think a lot of people have tried them. Some are curious, some don't know. Again, let's start with who qualifies. So
Hmm.
the BMI requirements are much lower for medications. So it's a BMI of 27 and above, or 27 to 29.9, who have weight related issues, or BMI of greater than 30 qualify for weight loss medications. Now, there's quite a few different types. So just to briefly go over them, there are the injectable meds, which there are two different major classifications of those. One is called semaglutide or semaglutide. I don't know how to exactly pronounce that.
Someone asked me that the other day, and I was like, I think I say both. I think I go back
I
and
say
forth.
both too, because other people do it, and whatever they say, I'll just like mimic it. I think it's semaglutide, but I've almost heard no one call it that. They call it semaglutide. So I don't know, whatever. So there's semaglutide, and then there is tirzepatide. Now, the semaglutide has two. Now, one has the FDA, Food and Drug Administration, indication for diabetes. And to prove that you have diabetes, you need to have a hemoglobin A1C greater than 6.5 at some point, a documentation that that exists, or a fasting blood sugar greater than 126. So if you have one of those two things at some point, and you want to use insurance, then we can attempt to get that medication. Ozempic is the brand name for semaglutide. For the brand name, Ozempic is what has the indication for diabetes. So we can work to get Ozempic approved for you. And then the FDA approval for weight loss, semaglutide, brand name is Wegovy. Now, these
Hmm.
medications have different dosing, but they are weekly injections, and there are some tremendous results.
Hmm.
Sometimes people don't respond. Sometimes they are super responders. Sometimes they get side effects, which are usually something more like GI in nature, like nausea, sometimes even vomiting, constipation. And we're going to talk about all of that, when to take it, how to take it, what to expect, what are the contraindications if you've had a history of medullary thyroid cancer, if you've had an intolerance to it in the past. Sometimes you just can't tolerate the nausea. So we'll talk about all of
Hmm.
those things. So those are the semaglutide. Now, the tirzepatide, the brand name for diabetes is Mounjaro, and the brand name for weight loss is Zepbound. The thing that's crazy is the exact same med. They just literally slapped a different label on it, and it's the
Hmm.
exact same dosing. So they actually, I like it because they make it easy for me to
Yeah.
determine it. In addition to being a GLP-1 agonist, they are also GIP agonists. So
Hmm.
because of that, if you want to look at, if you're a geek and you want to kind of read out about all of the evidence, the manufacturer of that is Eli Lilly. They put out a major paper. It's called the Surmount trial, and it talks about all of the evidence following patients long-term, placebo versus tirzepatide, and the expected weight loss that you can expect there. And right now, it's the leader of all the medications in the pack is the tirzepatide, and second best is this semaglutide if you look at the evidence right now.
Yeah.
So that's interesting.
I mean, and we're seeing incredible results. I mean, you see it, like we said, kind of the lifestyle of the rich and the famous has been the Ozempic, but which is funny because I'm like, that's the diabetes one. Like at
I
least say
know.
Wegovy if you're gonna
I
do it.
know.
But for a while Ozempic was the only thing out there, so that's what people were getting. And for a while you were able to kind of eke your way through it with getting the diabetes meds for weight loss, and that is not a thing anymore. Like it's just not gonna, if you don't have diabetes, they're not gonna give you those. So you got to
No,
go
they're
for the weight
so
loss ones.
strict on it. They're so
And
strict
that's,
on us.
I mean, I think that's the hardest part with the injectable medications is truly coverage because these are not cheap medications. I mean, they are $1,300 to $1,600 a month cash pay prices for them. So even with coupons, I mean, people are still having $800 to $1,000, monthly costs for those. And that's if they like accept the coupon. So it's a whole thing. And that's, I don't know, it's been a really difficult, I would say that with our medical weight loss program has
Mm.
been the biggest rock in our shoe is just trying to get people's coverage to sometimes they have it and like they still get denied and we can't figure,
Ugh.
it's just we're just trying to figure it all out. So if you don't have coverage of those and you don't want to go, and we'll talk about compounded medications in a second. But if you wanted some other options, there are oral medication
Yep.
options. And those, fortunately, we can get in generic forms. And so from a cost perspective, they are very cost effective. You can get them covered with like GoodRx, if your insurance doesn't, cover it or anything like that. And usually they're less than, $10 or $15 a month for those. And that would be phentermine or a generic form of Contrave. So
Exactly.
those are some other options.
So yeah, we'll be able to, we look at the whole picture, including the financial aspect, also your
Hmm.
medical history, obviously. And then
Hmm.
finally, we want to make sure that it works. And I'll tell you what, we've been doing this and we have a couple hundred people in it. Still, my highest weight loss goes to a phentermine patient. So if you
Wild.
can tolerate the side effects and it's great medication. It really
Yeah.
is. But there can be some side effects, such as it can give you dry mouth. It can make you feel like your heart is racing, some palpitations. It can make it very difficult to sleep
Hmm.
because it is just, but some people love that. It's just like, I
Yeah.
felt so productive. It's like ADHD medication. I just feel like I'm on and I'm good. But we can talk about that. And then Contrave, like you said, we give it in its two generic components, which is naltrexone and bupropion. So we ease up into that as well. I know I'm throwing all these, we're throwing drugs at you and dosages at you and side effects at you. And which ones we're still probably not answering which one's the best for me. So in that case, if you're really thinking, I don't want to look at surgery, I don't even want to talk about it, I don't want to have a consult, we get it. If you want to have a consult, though, about medical weight loss, I think that's the easiest way to really discuss all of your options. Look at your history, your allergies, your goals, your past successes, maybe some things that did not work for you, when you gain weight, why you gain weight, where you'd like to be, how do we keep you there? So
Hmm.
the way we're doing it, we want to keep it really simple, is we would have a consult the next Tuesday with me, and you would have a virtual consultation, and then I would review our three, maybe almost four different programs. So I'm going to talk about what the four are, and then Hannah, I want you to go into more detail. So we have our medical weight loss program. We have our medical weight loss plus program, our compounded program, and then kind of a twist on that is our compounded plus, which is our tracking plus project reset. So Hannah, would you like to tell us about, I know it's like, what the heck? That was like 6, 7, 8 things that you could go for. But I promise you, we will get you in the one that fits, again, your lifestyle, your time, your resources, and obviously the results that you want.
Yeah. And before I go into the programs, I did want to say we did an entire series on the podcast about medical weight loss as well.
Mm,
So obviously, we are going through these medications very quickly and just kind of touching on each of them, but we really dove deep into these. So go back
yes.
and listen to those if you want more information on in depth about these medications before, you get started on this. And some things may have changed because we did record that at the end of last year. So of
Yeah.
course, things are always changing and updating, but check it out. Still a lot of really good information there. So to go over our kind of 4 programs here, the medical weight loss is going to be if you just know you're like, you know what, I want medication, I just need that support. That's what I'm looking for right now. You would have that consult, and then you would be in our program. You'll pay a monthly fee to get your medication prescribed. We'll do any prior authorizations. We're going to do all that behind the scenes paperwork, all that stuff for you. So that's kind of the most basic one that you can do. Then there's the medical weight loss plus. So you would still have that consultation. Then what we'll do is we'll get you enrolled. You'll get ordered, you'll get shipped a smart scale by Withings.
Mm,
And so that is something that we can track from our office. We see your numbers in real time. We keep an eye. You get little like alerts. You get text with extra things, recipes, and good jobs and tips and all of this. And then you can always reach out and if you're having problems, it's a great way to kind of get started. You can ask questions, nutrition, if there's issues with the medication side effects, of course, you'll have all of that support. In addition to that smart scale and tracking, which that's kind of that extra component, you will also have the option to enroll in Project Reset. And Project Reset is our mindset focused 12-week program that works with Laura Graybell, a bariatric therapist, that you'll have weekly live sessions. They are almost like small group therapy. You also will be receiving meal plans, exercise guides, motivation pieces. You'll get education material. So it is a very comprehensive program. So that would be included in that medical weight loss plus as well. And then also there's weekly sessions with me that are just kind of like open office hours that you can drop in. Just say, hey, if that's what you want, you can ask questions. If there's more, multiple people in there, you guys can chat, tell us your successes. We want to hear your stories, all of that. So those are another thing that's included with that Medical Weight Loss Plus program. If you decide to not go with a prescription, like through the pharmacy kind of thing, you can go with our compounded program. So maybe I don't have coverage for Wegovy or Zepbound, but that's what I want. I want to be on
mm,
those medications. We offer those as a compounded medication, and that is going to be something that there's no like monthly cost with that. We'll just you'll pay basically for the medication and we get that shipped directly to you. You inject it, and that's that program. So then if you would like to add on to that, you can make that the compounded plus, which would get you kind of all of those same additional features from the medical weight loss plus. So the tracking, the project reset, the weekly office hours, those kinds of things. So that's that plus if you wanted to add that on. If you're like, I want the compounded medications, but I also want all of that other really great support. So that would be kind of the other option there.
oh, you wrap it. You explain these things so well. I mean,
It's almost like we created them ourselves.
oh my gosh. Are you telling our secrets, by the way, just flowed off your
Uh-huh.
tongue there so
Mm-hmm.
easily? I mean, no, I think it's a really great summary. And also check out our website,
Mm-hmm.
bodybybariatrics.com. We have a bariatric surgery tab that tells you all the things about that. We have a medical weight loss tab. We have a lot of information about Project Reset. Like you said, it's mainly focused on the mindset piece with 12 small group, kind of interactive live therapy type sessions where you'll learn cognitive behavioral therapy strategies, emotional eating, your triggers. Patients are loving those so
Mm-hmm.
much. And that's been like a career highlight is to finally like pull it all together and make it so, so, so comprehensive. And there's also, like you said, there's a lots of tips and tricks and weekly kind of recap email offerings that go over not just the mindset piece, but of course your tailored meal plans, like you said, and then also motivation and movement tips. And then before each session, there's even a video that patients get that is basically a summary of what's to come so that people can really be thinking about it. So when they go and attend that live virtual session, they feel like they've already really been thoughtful, been mindful about that whole piece of it as well.
Yeah. And if you're thinking, you're hearing all this and you're like, I don't know if surgery is right for me. I don't know if medication is right for me. Project Reset might be a great place for you to start because it's going to be that kind of comprehensive, like I said, program that's going to give you a lot of lifestyle management tips as well. And so maybe that's a great place for you to get started. Maybe you're somebody who's had surgery previously and you kind of just need to get back on track and get refocused again. And that's a really great offer for that. So that is definitely something that even if you decide I don't want to do surgery, I don't want to do meds, I can just do that Project Reset. And then that really leads into that last kind of component of, and this is a component of all of these, is lifestyle management. So, what you've heard from your doctors of diet and exercise, or as they always like to say, eat less and move more, which is bad advice. But, you know, looking at what are we eating, how are we eating, how much are we eating, how much are we moving, how are we sleeping, how is our stress level, like all these other kind of lifestyle management pieces, those play into surgery and medication, but they also can be, of course, implemented on their own. And for a lot of people, they get to, even if it doesn't give them everything, it can get them started on that like success journey. So you can kind of get some motivation from like, all right, I'm making some changes and I'm seeing some results here. All right, now I'm ready for this next step. And now I'm ready to see like, oh, I've lost 5 pounds. Now I can kind of imagine what it would be like to lose 40 pounds,
Yeah.
you know?
Yeah, it's a fantastic starting point or transition point or resetting point, wherever you're at. I mean, we're all on the journey, highs and lows and all the things. So, wow, lots of information on our website. We would love to dive deeper into you and your history. So once you finally get kind of deciding if you want to have your consult for bariatric surgery, a consult for medical weight loss, just join a program, meet with you, do something with dietitian or nutrition rather, a la carte. There's all these different things, and you'll go to the website. Before we see you, we do have you, just like any other kind of doctor's visit, you'll fill out a questionnaire, and ours are pretty thorough, and you'll answer a lot of questions about your history, your health history, your medications, your allergies, even your surgeries. And then we're going to talk a lot about just your dietary history and your goals, and we get into it, and I want to make sure that we understand who you are and where you want to be, and we get you there. So lots of things. So check out our website, bodybybariatrics.com, and let us know, as always, what specific questions you have about any of these, and watch our Dr. X Dietitian YouTube videos of us doing the surgeries and getting the behind the scenes action
Her
into it.
doing the surgery, to be fair. It's not me doing the
I know, I
surgery.
always say we. I'm always like, we're all in this together. And
Yeah,
you're
we're
like,
all in this. I promise you the dietitian is not doing surgery. I know I say that every time we talk about this, but I just want to make sure people don't think I'm doing that.
I love it.
And if
Oh my
you're
God.
not sure which one of these things sounds right, or you're just like, I don't know, I want someone, text us. Text us
Yeah.
and we're happy to answer, and we can, send you these links if you're not sure, like I don't know how to even get to the website. Send us a text, we'll get you there. Our team is great. They'll help you out. 407-543-0971. Text us there and you will get a response. And we're happy to answer any questions that way too. Or of course, DM us on Dr. X Dietitian, or any of our Instagrams. You can
Yes.
find her at Dr. Dovec, me at hannahschuyler.rd, at BodyByBariatrics. We have so many exciting things coming down the pipeline, and we're just growing, and we're so excited to bring you all on the journey.
Awesome. Well, thank you for listening. And as always, we'll talk to you next time. Thanks again.
Bye.